everyone, and welcome to BEaTS Research Radio, a podcast and YouTube channel dedicated to communicating research and science to the community. My name is Nicole Chu, an undergraduate student from the University of Ottawa, and I'll be your host on today's episode. Joining us is Dr. Kanika Harris. Dr. Harris holds a doctoral degree in health behavior and health education from the University of Michigan and a master's degree in public health. Dr. Harris currently serves as the Director of Maternal Health for the Black Women's Health Imperative, a national organization dedicated to help protect and advance the health and wellness of Black women in the U.S. She also serves as the public health expert for the D.C. Mayor's Lactation Commission and the Maternal Health Equity Advisor for the state of Maryland. Thank you so much for joining us, Dr. Harris.
Absolutely.
We're so happy to have you on our channel. So I'd like to start by asking a bit more about your role as the Director of Maternal Health for Black Women's Health Imperative. Do you mind sort of giving us a general overview of what you do?
Absolutely. At the Black Women's Health Imperative, I am the Director of Maternal and Child Health. So I lead research, policy, and programming around maternal health in the United States. Work on research and evaluation for different projects as well, and lead the efforts in terms of, saving Black women and Black babies. Yeah.
Thank you so much for giving us an insight. So I'd like to ask, why is being part of Black Women's Health Imperative important to you?
That's a great question. The Black Women's Health Imperative has been around. We are coming up on our 40th anniversary of being here. And it was started by Billie Avery, who is an amazing reproductive justice advocate and kind of like, I would say, one of the mothers of the Black reproductive movement in the United States. And I got exposure to her and her work with the Black Women's Health Imperative. Back then it was called the Black Women's Health Project, I believe. And so, through that exposure as a young girl, it just meant so much to me to be empowered and know about my reproductive health. And so having an opportunity to have benefited from what the Black Women's Health Imperative did for me as a young girl, and then, become a leader with the Black Women's Health Imperative is just amazing. And, we're serving nationally over 20 Black women and girls, across the United States. So it's just a huge honor to work with them and work with the team that I work with.
That is really cool to see the full circle moment, how you were inspired and now you're part of the team working towards this greater initiative.
Yes.
Mm-hmm. So going back in the circle, you have led research projects both domestically in the US and internationally as well in Southern Africa that focus on women's health and HIV prevention. So how do you think these experiences shaped your present work? Did they have an influence?
They absolutely shape my present work in terms of how we see things may not always be the case, especially in Southern Africa. I did a lot of work around reproductive health, and the focus was really on education and awareness for young adolescent youth for HIV/AIDS at a time where HIV was skyrocketing. So this was, early 2000s that I was there. And what I noticed is that when you talk to people and you find out what's going on for those youth, education wasn't going to be the answer. The answer was going to be opportunities for them, either opportunities after school, opportunities to be engaged, opportunities to learn skills. That was going to be the prevention of HIV, not education. I mean, education was obviously helpful, but the education was not going to prevent them from risky behavior if they did not have other ways to engage beyond school hours. And so understanding situations like that, understanding that whatever you do, you have to fundamentally understand what that community is going through from many, many different angles. The community has to be a part of design, implementation from the very beginning, or you're just really making a shot in the dark or assumptions about situations that you really don't know what's going on. The research can tell you one thing, but communities are capable of solving their own problems and issues if they have the resources and support.
Mm-hmm.
So that's how I go about my work.
Well, thank you for sharing. Yeah, I think you mentioned how, like a lot of research, they collect a lot of data, but these data are like representative of real people, right? Not just numbers.
Yes, absolutely.
Mm-hmm. So you've mentioned before, like in past interviews, how improving maternity care should not only be highlighted during, the 40-week time span of pregnancy. So how do you think Black women can be better supported during periods like before pregnancy and after their baby is born?
So, yeah, when we're looking at the maternal health from a life course perspective, you're looking at how you show up when you become pregnant, because pregnancy is essentially a big stress test on your body. You're working every organ twice as hard. So how you show up in pregnancy is extremely important. What happens during pregnancy is kind of what we tend to focus on. And then how you deliver and what complications you may experience during your pregnancy can literally dictate the health for the rest of your life. So, so I try and look at maternal health as something across the life course, and that's really important in terms of how young women or women show up during pregnancy. And so, in terms of programming in that area, focusing on preconception health and fertility, because it's not just pregnancy, within the issues surrounding Black birthing people right now, fertility becomes an issue sometimes as well. So understanding where your baseline is, how are you showing up when you're pregnant, is extremely important. How healthy you are in order to, have a successful pregnancy and birth, you really have to be healthy. And then if you're not healthy, how are you going to be treated? That needs to be known at the onset. So after pregnancy, it's extremely important to be able to have the support, have the informational support, have the tangible support, hands, have the emotional support, have a team of people that are nurturing the mom while she nurtures this new baby.
Mm-hmm. Yeah, I think you brought up great points about the holistic care of maternal health across the lifespan, and I completely agree. Mm-hmm. And for my final question, I was just wondering, in your opinion, what are some of the key next steps that you would like to see when working towards eliminating the racial disparity which exists for Black women in healthcare?
Yeah, so the key next steps I would like to see is legislators, policy, funneling more money to Black leaders that are working on these issues, to Black birthing centers, to Black-led birthing centers, to funnel more money for Black physicians, funneling more money into communities so that they can have the support to support their family members and community members through pregnancy, etc. More money for research. So it's basically, when I said earlier, communities have they have the knowledge and the tools and the ability to solve their own problems. So in this case, Black researchers, Black leaders, Black midwives, Black doulas have to be at the forefront of solving this issue. It's not something that has been well solved. We've seen the infant mortality gap even widen since slavery, when we didn't have access to hospitals and we didn't have access to medical care. It's wider today than when we had lay midwives, helping us in our homes. And so that says a lot. So what I think is funneling money to Black-led organizations that have the answers and the solutions to solve these problems.
Yeah, I completely agree. And I think having leaders like yourself as part of these initiatives like Black Women's Health Imperative is so important.
Yes.
Yeah, well, thank you so much, Dr. Harris, for joining us today and giving us a greater insight on your role as part of Black Women's Health Imperative.
Absolutely. Thank you for having me.
We're so honored to have you on our channel. And thank you to all of BEaTS Research Radio listeners for your time as well. Don't forget to like and subscribe to our YouTube, Twitter, and Instagram channels at BEaTS Research. And on behalf of our entire BEaTS Radio team and our director, Dr. Emilio Alarcon, we wish you all good health and hope to see you all next week. Thank you.